friends, and in view of the global nature of VIROC, I'm going to talk to you about what's in and what's out in the fascinating world of knee arthroplasty. So 1/3 of our TKR patients still remain dissatisfied despite all changes in design, approach, etc. So the holy grail still remains the forgotten pain-free knee joint. So I'm going to talk about global advances in 3 compartments: customization, the application of emerging technologies, and data integration. Firstly, customization. Personalized arthroplasty is now here, thanks to advances in imaging, for example, these weight-bearing CT scans, as well as sophisticated methods of assessing the cartilage, allow us to perform compartmental arthroplasty. And the key is retaining the ACL, and that's one of the keys to having a forgotten joint. And these are the sort of cases that we can do when we are sure that the cartilage is affected only in limited compartments. Similarly, 3D reconstruction of bone morphology has shown us that all legs are not the same. In fact, we've described 7 phenotypes of varus and 9 phenotypes of valgus knees. So because there's so much of variation in the morphology of the distal femur and upper tibia, you cannot cut all of these patients at 90 degrees and restore the joint line, which again is crucial. And for that, you have customization, not only of implant positioning, design, technique, but also rehab. And this starts off with detailed planning, and you can do this with CT or MR based, or you can do it CT free on the fly during your surgery with the software. And in order to achieve precise execution, you have PSI, patient-specific implants, navigation, and robotics. And we now have the 3rd generation super fast, sleek robot, which is available. However, a mismatch can still occur between the off-the-shelf implants and the patient's anatomy, as for example in the trochlear mismatch, as well as in the radii of curvature. And for this, we now have 3D printed custom implants and jigs, which are all designed with a given patient's anatomy and structure in mind. And you can produce these custom made with the patient's name and serial number on the package. However, soft tissue balancing is the key to knee replacement, and everyone's soft tissues are different, so individualized ligament balancing is important, and you can see these severe deformities. Using the latest software, you can achieve perfect ligament balance. You can also do this with smart trials, which have sensors which give you readings of the tension within the joint. A lot of evidence-based techniques have evolved which allow us now rapid discharge and the dispensation of tourniquet, drains, as well as blood transfusions thanks to TXA. Followed by targeted telephysiotherapy. So patients go home and then they can just do the physio that they require for their particular case. And in case infection occurs, there is no need for a 2-stage revision in all cases. You can do a 1-stage revision in selected cases, and the results are fairly good. There are a host of emerging technologies which are now being applied in the field of knee arthroplasty. And for example, wearable sensors give you exact data about the knee after surgery. Nanotechnology, we've got 5 patents in this. For example, in the prevention of infection, you have implant release from nanoparticles, which allows prevention of infection. Similarly, cementless fixation is now going to be routinely possible, and nanostructured surfaces not only allow osseointegration, but also antibacterial properties. We have smart implants with transmitters, which give off information about the pressure and gait while the patient actually walks about. We have AI and ML now coming in the field, and you can use algorithms to actually automatically measure X-rays for complications. And lastly, training and teaching with virtual reality, which has now become a reality, and you can dispense with sawbone workshops as well as cadaveric workshops. And lastly, you integrate all the digital data that you obtain from all these various sources into the patient so that you can then achieve the holy grail of a forgotten knee joint. So the future is remote controlled surgery, perhaps, over 5G networks. So friends, that's the exciting world of knee arthroplasty, where training, technique, and technology are all converging. Thank you.